So I wanted to, the first talk that I gave, I wanted to talk about screening and getting to know your skin, getting to know spots, and advocating for yourself, like so many people have talked about. Hey, doc, what is this? I'm concerned about this. And the other part I want to talk about is what happens if you've been diagnosed with a melanoma or you've been diagnosed with skin cancer that needs treatment. What is it that dermatologists do in terms of treatment that you could be aware of, be prepared for? So in dermatology, we treat many different kinds of skin conditions, not just cancer, not just melanoma. And so for many conditions, we prescribe what we call topicals, which are skin applied things like lotions, creams, but they're medicated and they help typically calm down inflammation, which is causing a rash or a spot of concern. We also use pills or injection medicines for conditions like eczema or psoriasis, depending on the severity. And of course, these can happen in populations of color as well. So these are not limited to any one population, just like melanoma is not. And then for surgical treatments that we do, we treat skin cancer very commonly with surgical treatments of various kinds. Important to note that no sedation is required for the surgeries that we do. It's local numbing only, kind of like going to the dentist. If there's a spot that was biopsied and it turned out to be a skin cancer, we would do it again. And you would be awake. You'd be talking to the doctor, talking to the staff in the room, letting them know that you're comfortable, that things are going okay. They're making conversation with you so that you feel comfortable. And this is what a surgery might be for a melanoma that is in an early stage, where there's been identified a spot on the arm here. And now in clinic, we draw a circle around it, which is our margin, to make sure that we have a safe amount of normal skin where the melanoma cells may have spread beyond what our eye can see. And then we take it out and it lives, which is this oval shape, and then we draw it back into a straight line. Melanoma treatment itself is determined based on the depth of the lesion underneath the microscope. So again, our dermatopathology colleagues, the people who read these slides under the microscope, are very critical for determining the depth and in turn the treatment that a patient needs. So on the left part of the slide here, I'm showing 5 different melanomas, each of various depths. And so when you think about the skin, there's the top layer that faces the environment, faces the sun, the sky, the trees, the clothes. Underneath that are the nerves, the blood vessels, the fat, and the nerves and the blood vessels are how melanoma spreads to other parts of the body. So the deeper it goes, the higher the risk is that it's going to spread to another place. And so when that happens, when the pathologist says that this is a deep melanoma, for example, it's number-based, more like Dr. Salami was talking about, severity of the depth, and there's a metric that we follow. But the deeper it goes, then you may need to involve additional surgeons, additional doctors like hem-onc doctors who prescribe systemic or IV chemotherapy drugs to help treat the melanoma. The good news is that melanoma has a very bad reputation historically, but that's improving. So our treatments in melanoma have gotten way better over the last 10 years, over the last 20 years, and certainly over the last 50 years. Patients are doing much, much better. So, the most important thing with melanoma is catching it early, knowing your ABCDEs, knowing what you can do to monitor your skin, to bring spots up to other people and other doctors. And there's the advocacy that it takes to do that. We recognize that. Another point of advocacy is dermatology. We're trying to create a more diverse workforce of dermatologists so that, we are better connected with the people in our community, and that when they go to the doctor, they see someone who looks like them or has had similar experiences than them. So we're advocating on our end as well to try to improve the difference in outcomes and disparities in dermatology. So again, that's all I have. Thank you very much.